We are going to discuss scabies today, which is a contagious skin condition caused by an infestation of mites. So not an infection, it's literally an infestation, but it's easily treated, don't worry. The scabies mite is formerly known as Sarcoptes stabi, which comes from the Latin word to scratch, and scratch you will. These mites make your outer skin layer their home and burrow in there, laying their eggs and generally having a wander about. Transmission is by skin-to-skin contact and from eggs and mites that have in clothing, bedding, etc. So very contagious. No rubbing up against each other, please. Diagnosis is by taking a patient history and examination. So history will be asking patients questions such as, are you itchy? What and where are your symptoms? What are the areas affected? And any of your contacts, like family, friends, partners, etc. affected? If we're not quite sure about the diagnosis, we can take a skin scraping, look under the microscope to see what's going on. Hello. So symptoms. Itching. So much itching. Usually worse at night, and for those interested, it's actually a type 4 hypersensitivity reaction to the mite and its eggs and feces. Lovely. Your skin does not like these unwanted visitors and will soon let you know about it. Some people may not experience the itch if they have desensitized skin, for example, if they have neurological issues, and babies don't tend to either. So worth remembering if trying to diagnose. Next, we have itchy red papules. A papule is a small, well-defined bump in the skin, which is erythemaceous, which just is a fancy term for red. The papules are small and may be crusty. A burrow can usually be seen as a thin grey or brown line with a dot at the end. This is the mite on their travels, and you can see where they've been and where they're going. Areas that are usually affected are interdigital spaces between fingers and toes, buttocks, breasts, genitalia, the wrists, the axillary folds, which are just the armpit folds, extensor areas or limbs, and waist. Areas not usually affected are the back, the head and the neck, except sometimes in children. So if you've got itchy lumps in your groin and armpits, it's a good chance it's scabies. Come and see me and I'll let you know. Symptoms will usually begin 3 to 6 weeks after the initial infestation. This can be as quick as 1 week if you've already had an infestation before, as the body remembers and is already sensitized to the mites. So because of this and how contagious it is, it's important to treat all household contacts at the same time as yourselves, as they may be in the early stages of infestation. But I'll be discussing the treatment soon. Can there be outbreaks of scabies? Yes, there can. Depending on living conditions, you tend to get outbreaks in close-knit or overcrowded areas such as nursing homes, prisons, etc. Talking of care homes, I want to quickly touch on a type of scabies that is next level. It's called Crusted or Norwegian scabies. Remember that name, trust me. And there may be as many as 1,000 or 1,000,000 mites infect the individual compared to 10 to 15 in a normal case of scabies. Scary. This type can occur in immunocompromised individuals or care homes where everyone is so close-knit. Often there's no itch due to the underlying health of the patient and sheer skin thickening and crusting of the skin. This is treated in hospital with oral and topical products. If you're ever going to get scabies, you want to get the normal type, trust me. So now on to the treatment of normal scabies. Treatment does not kill the eggs of the scabies mite, so needs to be repeated after 1 week. Here we go. Permethrin 5% cream. This actually is a neurotoxin that works by paralysing the nerves in the respiratory muscles of scabies. It's licensed for over the age of 2 months old, but children under 2 years should really be treated under medical supervision. Scabies is very rare in children under 2 months old, so it's not really licensed at all for this age group. It's available on prescription or over the counter at a pharmacy. You apply it once weekly for 2 doses all over the body. Pay attention to finger webs, toes, under the nails, armpits, breasts, buttocks and genitalia. So once applied, you wash off after 8 to 12 hours and try not to wash your hands in this time. So it's a good idea to apply it before bed and then just shower it off in the morning. Don't use this product on broken skin and only use on cool, dry skin. Not after you've had a hot bath or shower, as this can increase absorption and therefore side effects. It can burn a bit on application and sting, but this is usually quite mild and transient. but worth keeping in mind if you're applying to young children. 1 or 2 tubes of 30 grams may be needed to cover the whole body. Don't use more than this. And there's no need to apply it to the head and the neck. Younger children will need less. If you're pregnant or breastfeeding, it's thought to be safe, don't worry. So this is pretty much the only treatment now we recommend in the UK. Ivermectin is an antiparasitic drug. It's usually only used in crusted scabies, or if the patient is immunocompromised. A single oral dose is taken with water on an empty stomach. Avoid in pregnancy and only use in breastfeeding if you absolutely have to. Is there anything else we can use to help? Yes, there is. Antihistamines are very good for the itching, such as chlorpheniramine or Piriton. It's better than the second generation antihistamines, such as cetirizine, due to their sedating nature, and you are going to need it at night, trust me. I say that like I get it all the time. I've never actually had scabies, so you'll have to let me know in the comments if you've ever had it before, and is the itch as bad as everyone says it is? Is it really that bad? Oh. Also for itching, you can try Crotamiton cream or Urax. It's an antipruritic, which just means anti-itch, and cool baths and showers. It's not just important to kill the mite, we must try and get the scratching under control, as it can cause a secondary bacterial infection such as impetigo. Really important. There's some patient advice as well to go alongside the treatment options. As I've mentioned previously, it's important to treat all household contacts. Also, wash all bedding, towels, clothings in the house, at 60 degrees or higher, just to kill everything. Use a hot dryer if possible to kill the mites and eggs if you can. If you can't do this, just pop whatever you can in a sealable bag for 3 days and the mites will just die. Once treatment has been applied, you can go back to school or work. I would actually leave it 24 hours if you can, just to be safe. Itching can persist for up to 2 weeks after the treatment, so don't think it hasn't worked. The mites will be dead, but the immune system is still responding to them. Once they've been broken down and absorbed by the body, you will feel better. And you can't catch them from your pets, don't worry. And before I go, and thanks for watching by the way, this is the most important part of the video. It's important that I mention that anyone can get them. It's nothing to do with hygiene or social standing. Nobody is safe. Let's try and stop the embarrassment and stigma, shall we?